This module is designed to provide information on public health insurance plans, specifically Medicare and Medicaid. The module will give a brief overview of the plan and explain important information on the different types of coverage, who is eligible, and where to get assistance. By the end of this module, you should be able to identify the difference between Medicare and Medicaid and explain the parts of each program and who is eligible. You will also be able to tell your clients where to go to get assistance applying for each program and what information they should bring with them to the enrollment appointment. Medicare is a federal health insurance program for people aged 65 and older and some individuals with disabilities. Medicare has 4 parts: A, B, C, and D. Part A covers hospitalization and emergency services. If a client has worked for at least 10 years, they are typically eligible to enroll in Part A at no cost when they turn 65. For most people, the enrollment is automatic. Part B covers office visits, outpatient care, and preventative services. Most people have to pay a Part B premium, which is usually deducted from their Social Security check. If you choose to delay your Part B coverage, you may have to pay a penalty when you do enroll. Some low-income individuals may be eligible for a Medicare Savings Program, also called dual eligibility, where Medicaid covers the Part B premium if their income and resources meet certain requirements. Part D covers prescription drugs. Part D coverage can be purchased by private insurance companies. You can also purchase additional coverage through Medicare supplemental insurance. Another option is to enroll in a Medicare Part C plan. These are also known as Medicare Advantage plans. Advantage plans bundle Medicare Parts A, B, and D and additional benefits into one plan that is similar to commercial health insurance. You purchase Medicare Advantage plans through private insurance companies. The first step in getting started with Medicare is to learn about the different plans. Next, you need to find out when you can get Medicare. Many people are enrolled automatically. The initial open enrollment period to enroll in Medicare for the first time is 7 months. It begins 3 months before you turn 65, includes the month you turn 65, and ends 3 months after you turn 65. For example, if your birthday is in September, your initial open enrollment begins in June and ends through December. Step 3 is to decide if you want Part A or B. Most people choose to enroll in Part A even if they have access to employer coverage. You may choose to delay Part B if you have insurance through your employer, but if you delay, you might have to pay a late enrollment penalty. Step 4 is to choose your coverage. Do you want to enroll in Part D in a supplement? Do you want to bundle your Medicare in a Medicare Advantage plan? State Health Insurance Plan or SHIP coordinators can help you get started with your Medicare coverage. They can help you compare your different options like application assisters do for Medicaid and Marketplace plans. You can find a local SHIP coordinator by contacting your local area agency on aging. Step 5 is to sign up. If you are automatically enrolled in Medicare, you will receive your Medicare card, also known as the red, white, and blue card, 3 months before your 65th birthday. Medicare's website includes a list of important tasks for your first year on Medicare. Medicaid is an income-based insurance program. It is the largest source of health insurance in the United States, with over 72 million enrollees. The primary goal of Medicaid is to furnish health insurance for low-income individuals and families. Medicaid is jointly paid for by state and federal governments, so Medicaid rules vary from state to state. However, there are a few mandatory eligibility groups: low-income parents and caregiver relatives, pregnant women, children, and aged, blind, or disabled individuals. The Affordable Care Act gave states the option to expand Medicaid to an additional category: low-income, non-disabled adults. This category is known as the expansion group. In states that chose not to expand Medicaid, many people fell into what is known as the coverage gap. That means that they are not eligible for traditional Medicaid, but because they make less than 100% of the federal poverty level, they do not make enough money to qualify for payment assistance on the marketplace. Kentucky chose to expand Medicaid at the beginning of the Affordable Care Act implementation in 2014. Medicaid is different from state to state, but there are 4 mandatory eligibility groups: low-income parents and caregiver relatives, pregnant women, children, and aged, blind, or disabled individuals. These categories are collectively known as traditional Medicaid. Each category of assistance has different eligibility requirements and income limits. Some types of assistance also include a resource test. With the passage of the Affordable Care Act, states had the opportunity to expand Medicaid to more people. This new category of Medicaid is referred to as expanded Medicaid. In Kentucky, the eligibility requirements for expanded Medicaid are that you must be 18 to 64 years old, a Kentucky resident, not incarcerated, with an income less than 138% of the federal poverty level, and you must be either a U.S. citizen or a qualified immigrant. Additionally, most qualified immigrants usually have a 5-year waiting period. In 2019, the gross annual income limit for a single person in Kentucky is $16,753. The Kentucky Children's Health Insurance Program, also known as KCHIP, covers children age 18 and younger who do not have access to other health insurance. The benefits and coverage is the same as traditional Medicaid for children, but it has a higher income limit of 218% of the federal poverty level. In 2019, for a household of 4, that is a gross annual income of $54,718. Even if you have adult clients who are over the income limit for Medicaid, their children could be eligible for KCHIP. Another type of Medicaid is the 1915C waivers. These waivers provide support for people who are elderly or have a physical, intellectual, or developmental disability so they can stay in their homes. The waivers have different eligibility guidelines, but you must have a doctor's certification that without waiver services, the individual would need to be admitted into a nursing home. There are several types of 1915C waivers, including acquired brain injury, home and community-based waiver, Model 2 waiver, Michelle P. waiver, and supports for community living. They offer a variety of supports, including attendant or personal care, environment modification, counseling, behavior supports, and more. Some of the programs also include participant-directed services, where the client can hire employees, often family members, who can provide their non-medical, non-residential services. These waivers allow people who would otherwise need nursing home care to remain in their homes. Most application assisters are not trained to complete the waiver portion of the Benefind application. Clients can go to their local Department for Community-Based Services office or their local area agency on aging to apply for 1915C waivers. Medicaid eligibility for immigrants can be complicated. Immigrants typically fall into one of 4 categories when it comes to Medicaid eligibility. Some people, including legally present children, refugees, asylees, and Cuban or Haitian entrants, can get Medicaid right away as long as they meet the other technical requirements. Most permanent residents or green card holders are eligible for Medicaid only after they have been permanent residents for 5 years. Until they meet the 5-year waiting period, they can purchase a qualified health plan with payment assistance on healthcare.gov as long as they file taxes. People with statuses that are considered temporary or non-immigrant like student visas or employment authorization cards, are not eligible for Medicaid regardless of how long they have lived in the United States. However, as long as they file taxes, they can purchase qualified health plans with payment assistance through healthcare.gov. Finally, people with Deferred Action for Childhood Arrivals status, also known as DACA, B1 or B2 tourist visas, and individuals who are not legally present are not eligible for any healthcare coverage through either Medicaid or the Marketplace. People who are not legally present can still apply for Medicaid on behalf of their legally present or U.S. citizen family members. Presumptive eligibility is a temporary form of Medicaid designed to cover individuals with emergency medical needs. The presumptive eligibility application is much shorter than the regular Medicaid application, and clients do not need to prove their citizenship or immigration status. The goal of presumptive eligibility is to provide immediate medical coverage for people who are potentially eligible for regular Medicaid and are experiencing medical emergencies. Individuals who enroll in presumptive eligibility are encouraged to complete the full Medicaid application. Presumptive eligibility is limited to 2 months, but it may be extended if the emergency medical condition is ongoing. Clients would need to provide certification from their medical provider that they are still experiencing an emergency medical condition. However, presumptive eligibility for pregnant women is limited to 2 months per pregnancy. Additionally, presumptive eligibility may only cover services related to the emergency medical condition. Presumptive eligibility is not considered minimum essential coverage for the Affordable Care Act. Most application assisters are not able to complete presumptive eligibility applications. However, many hospitals and community health centers have other staff on site who can complete the application. Clients can also apply at their local Department for Community-Based Services office. Clients will need to provide proof of pregnancy or a provider's certification of the emergency nature of their medical condition. Beginning in January 2019, the state began charging mandatory copays for most people on Medicaid. Some groups are exempt, including pregnant women and children. The copays range from $1 for generic prescriptions up to $50 for inpatient hospital admission. If someone's household income is below 100% of the federal poverty level, they cannot be turned away for services if they do not have their copay. This includes pharmacy benefits. However, people with income above 100% of the federal poverty level can be turned away as long as the provider's policy is consistent. Additionally, there is a 4% quarterly cost-sharing cap. That means that if someone's copays total 4% of their household income in a quarter, they are exempt from copays for the rest of the quarter. The cost-sharing cap resets each quarter. This is a list of helpful documents to bring with you when you meet with an application assister. If you are missing any of these documents, the application assister can still help you start the application, but it may slow down your eligibility determination. You need to bring in proof of income for anyone in the household, but household members who are not applying for coverage do not need Social Security cards or immigration documents. If you've lost a job or changed jobs recently, you may also need to bring in proof of when your previous employment ended.